Hello everybody, I'm so sorry that we've had a technical issue today. I believe it's our first one. Okay, let me just check a couple of things. Okay, firstly, I'd like to say hello again and welcome everybody to week 3 of our wellbeing webinars. For those of you that don't know me, my name is Martine. I have been a massage therapist for the Disability Foundation for the past 17 years, providing remedial deep tissue and holistic massage. As we all know, it's not open at the moment, so we've started doing these wellbeing sessions. So today I will be offering everybody some self-massage and stretching techniques for the lower back. If you're not so familiar with this, it's an effective way to relieve muscular tension, as well as trying to help manage stress and worry and anxiety for improved well-being. In this session, you will be guided through some simple and effective self-massage techniques to warm up the muscles, relax the tension, and target any problemed areas. By the end of the session, hopefully you'll be able to take away some of these techniques to practice every day. And each of these sessions are available for all different therapists. So we're here every weekday at 12 o'clock. So I'd just like everybody to remember that all your videos and microphones are switched off. So nobody, including myself, can see or hear you. If you have any questions about anything at the end of the session, you can contact the Disability Foundation. I believe it is therapy support at tdf.co.uk, and they can advise you of any of your questions. Please remember that we are a charity, so all donations are welcomed. And I just want everybody just to make themselves comfortable. Today we will be standing. So please just remember that you need to pace yourself according to your own ability, and you need to work within a pain-free range. If you find any discomfort whatsoever, please stop the activity that you're doing. You can stop at any point. Remember, you're the one that's in charge, okay? So anything that feels a little bit tight or uncomfortable or painful or just doesn't feel right, please stop that the moment and wait till the next exercise comes along. Okay, lovely. So we are going to start with the lower back. So just so you know, it's a quick fix. This is generally a quick fix. So I'm just organizing myself here because I need to stand up. Okay, so the lower back. This is a quick fix, basically helping us to relieve any stiffness. We tend to often wake up with aches and pains, particularly in our lower back. So hopefully this will relieve some of the tightness that we may have. Just want to make sure you can all see me. Okay, so we're going to start off with some gentle rotations. I just want you to have your arms out and just to swing, just a nice, comfortable, flowing movement, just to wake anything up. Just get those joints moving a bit in the spine. And just swing your arms a little bit further. And you can even look behind your shoulder, which will increase the range of the rotation. Okay, we can then just give a little tap to our stomach and our sacrum at the back, as you can see, stimulating our kidneys and just waking everything up. Okay, we're next going to just do some nice gentle hip rotations. So we just want to imagine you're just making a big circle with those hips, sticking your bottom out, trying to make a perfect circle Remember, everybody's limit is going to be different. Some people might only be able to move like that, and that is absolutely fine. If you can give it a good old swing all the way around, really trying to feel every little movement that's going on there. Try to keep your upper body straight. And again, just keep thinking about your breathing. Taking nice deep breaths in. And now we're going to take and go to the other direction. So again, nice big circles. That's lovely. Okay, so we've hopefully warmed up this area. All I just want you to do now is, if you can all just place your hand on your stomach and your hand on your sacrum at the back. And all we're going to do is just small movement, tipping backward and forward, pulling in through the stomach and the pelvis, coming up and sticking your bottom out and lifting. Try to remember to keep those shoulders nice and straight. And again, this is just getting this whole area moving and warming it up and getting it going in different directions that you normally wouldn't be using. Okay, we'll do that 2 more times. Again, everybody's going to have a different range. Some people might find that they can move it very, very slightly. Some people might find they can really, really extend that back out and bring that pelvis up. Okay, so now for most of this, I will be having my back to you. I'm hoping that everybody can hear me. So what we're going to start off by doing is some friction across the sacrum. So what I want you to do first of all, give your arms a nice shake. You might find that your shoulders might ache a little bit when we do this. That's completely normal. It's just because you'll be having your arms up for quite a while. So we're just going to warm up from the sacrum and working your way out. From the midline of the body, giving it really nice rub, really warming up those muscles and coming out. And work your way up as high as you can, up the back. Lovely. And then we'll start again at the bottom, down, working your way out and working your way up, up and out. Again, we're just warming up this whole area. Okay, they should be nice and warm now. So what I'd like you to do now is, using your thumbs, we are going to palpate this muscle either side of the spine. And I just want you to feel in and gently make small circles with your thumbs, working from the midline of the back. We're going to work our way down. So we're doing it in 3 sections. We're doing it in 3 sections. This will be section 1. This is section 2. And just on the outside is section 3. So give those arms a shake. If they're starting to feel achy, give them a good old shake. Lovely. And start from the top, should I say. Start from the top as high as you're able to. Some of you might have much more of a range. You can get higher. Some might not be able to get too high. And just work your way down, continuing with nice small circular movements. And then we'll go to section 2, coming out a little bit from the midline of the body. Nice thumb circles. Try to relax those shoulders and keep coming down. And just trying to think about those tender spots. Any tender spots you might find, you can just hold. Any little sore spots, find them and sink into them and just hold them for a few seconds to release some of the tightness. Okay, again, let's just give those arms a nice shake. Okay, so what I'd like you to do now is make a nice loose fist, okay? Not a tight fist. where you punch somebody, you make a tight fist. You want them nice and relaxed, okay? So nice, really loose wrists, okay? And what we're going to do is just, this is a nice taponement, this is called, okay? So this is a technique that you use. You're basically, you can either alternate one at a time. And again, we're going to start as high up as you can. 1, 2, and just gently tapping along those muscles. If some people might find it easier to alternate at the same time, so if you prefer to do that, that's absolutely fine. And then we're going to just work our way out. So we're starting at the midline of the body, and then working your way up. Okay, let's give those arms a nice shake because I'm sure they're aching. Okay, let's give a nice shoulder roll. Nice shoulder roll. Okay. And then we're just going to get that nice fist again. Okay, we're going to turn around. And what I want you to do now, using your knuckles, is just sinking in again, either side of the spine. You're just pushing and holding with this one, with those knuckles, just as we were doing with our thumbs, but you get a better surface area here using your knuckles. Okay, and again, finding any areas that you find tender, just hold and let them release. Going right in as much as you can, really push that muscle. Okay. And just keep going up and holding. Okay, lovely. Let's give those arms a nice shake again. Okay, but now we're just going to kind of work into our glutes, into our hips. So again, using your fists, I want you just to start around your coccyx and use your knuckles to gently massage all around those hips, all around that crest. Okay, working into the glutes. We all hold lots of tension in this area. And again, finding any areas that are tender, you just want to sink in and hold. So keep massaging all the way along. I've got very tender spots right there, so I'm just going to sink in and hold, using my knuckles for pressure. Okay, keep going all around those hips. Lovely. Then we can give them a little punch, nice gentle punching, all the way down, all across your bottom, coming back up to the lower back. Lovely, lovely. Okay, that's good. Give those arms a shake. Okay, so now what I'd like you to do is put your hands on your hips, and you know where our waist is, where you get the crease. When you bend to one side, you've got a crease. What I want you all to do is get your thumb. We're going to start on the right hand side, and I want you to gently do a side bend into the right and let that thumb sink all the way in. And if you have a little feel around as you're sinking in, you're probably going to hit something that might feel a little bit tender. This is a muscle called the quadratus lumborum, QL for short. And this does a lot of the side bending, and it's a small muscle, and it can get overused, and it's very common for people with lower sore backs. So I just want you to use that thumb, palpate around. It'll be just above the hip. You can just get right into that crease in your waist and sink in and hold. Again, when you're doing this on your own, you can just have a feel around. You will find there'll be certain areas that will feel much more tender than others. And I just want you to hold those spots. Okay. You can even, so if we just start this again, you're going to get that thumb, we're going to sink it in and side bend. I'll do it from this angle. You're side bending. And so now keep that thumb in and stand up straight. And then you'll feel the pressure being applied as you stretch out that muscle. Feels really good. Let's do that one more time. Sink your thumb in, find that tender spot, hold. And then I'd just like you just to stand up and feel the muscles underneath it as they're beginning to get tighter when you stand. Right, and we're going to do the same on the other side. So we're going to find that crease in your waist. And again, it should be just kind of above our hip. So you've got your hip area, and then you've got like a fleshy part. And if you side bend, you should be able to get your finger in that, or your thumb, should I say, in that area. So you're going to sink into it, have a little feel around, see what's going on, find any tight spots, just hold. And let's do what we did on the other side. Once you've got that, if you stand up straight and keep that thumb sunken, and as you bring yourself up, you can feel the muscles contracting and apply pressure. Now we'll do it one more time. Sink in and bring yourself up. Wonderful. Okay, all I'd like to do now, just with the finishing stretch, I'm going to want you to place your hands on your sacrum. I'd like your knees slightly bent. I don't think you can actually see my knees from there, but just so you've got a nice little bend in your knees. And all I want you to do is push your pelvis forward, let your stomach relax, and look up to the sky, keeping those knees bent because that will keep your balance. Keep that stretch. Sorry, my headphone has just come out. Okay, so holding your lower back, really dropping your neck back, pushing your hips forward. Just a nice stretch. And stand up straight. Keep those hands on your sacrum. We're going to do that one more time. So as you push yourself forward, keeping those knees bent, dropping your head back. Really feel a nice stretch coming all the way through the front. Okay. And we're just going to finish off with a little bit of massage to the top of our legs. So all I want you to do is, again, just bend the knees very, very slightly. You can use your fists and just gently give self-massage to your front of your legs, your quadriceps. And then you can maybe just gently punch them. Again, a soft fist. Going into the hips. Coming down. Okay, lovely. So hopefully you can take a few of those techniques away with you. I'm going to finish now with a short meditation. This is called the Inner Smile. So take a seat wherever's comfortable, on the floor, on a chair. You can lie down on your bed if you're in your bedroom. Okay, so I'd like everyone just to take a really nice deep breath. Close your eyes, relax your shoulders. Have your feet firmly planted on the floor. Imagine there's a gold string coming from the top of your head up to the sky, keeping that neck nice and long. Shoulders are coming down, drawing them back. keeping that posture as nice as you can keep it. And take a few nice deep breaths in. So let your body drop down into being at ease, like in a deck chair or in a comfortable chair after a really good meal. Remember that your body already knows how to be at ease. It has, for example, been doing it when you sleep or relax for decades. Your body already knows what it is like to be at ease. Perhaps after a good Sunday lunch, perhaps on holiday, sitting in your favorite cafe, or looking out across a beautiful view. After exercise and movement, in those situations, you are just physically comfortable and content, and sinking into yourself and calm. Right now, allow yourself to sink into those same sensations. Let your stomach sink and relax. Lower your chin slightly. Lower your eyes slightly, as if looking down to the ground. Notice the sensations on the soles of your feet, sensations of your clothes on your thighs, and take 3 very slow, very quiet, very soft, and very calm breaths, all the way deep down into your abdomen. Allow yourself to drop and sink fully down into yourself. Just like sitting at your favorite cafe or on your favorite sofa, or maybe your favorite beach. Bring into your mind one of those circumstances where you felt really contented and happy. A favorite view, a favorite place, being with the person you love. You can feel exactly the same now. Allow your body to drop down into being at ease. Let your stomach and abdomen drop and sink. And take 3 soft, quiet breaths as best as you can. Open your heart and feel some gentle love. Soften your eyes. And now turn your focus down into your own body. In the same way you might lean down and care for an injured child, or cradle an injured bird in your cupped hands. Direct this quality of kind care down into your own body. Have a kind and loving attitude to your body. Notice any feelings of distress, tension, or pain. Be accepting, tolerant, and kind towards it. Hold it and cradle it. Envisage your body as being like a tree with a strong trunk and deep roots. Your inner smile. Your inner smile is like the sun feeding the tree with light and warmth. Stay relaxed. Stay at ease. Allow yourself to feel connected to that feeling. Let it fully in. Absorb it. Soak in it. Notice the physical sensation of your body pressing against the chair, and then your feet resting on the floor, and your hands and your arms resting on your legs. Notice the sounds inside and outside the room. any obvious tastes, smells, and sensations. So bringing yourself back slowly, back to your senses and back to your immediate environment. And in your own time, bring yourself back into the room and open your eyes again. Lovely. Thank you very much for everybody who showed today, and apologies about the technical issue. Please remember that we are a charity and any donations are greatly appreciated. Thank you all, and I will see you next week. Have a lovely week. Thank you. Goodbye.